So osteoarthritis is a progressive disease that can affect multiple joints, and what I specialize is in hip and knee, and it progresses over time. And early in the disease process, there are treatment options that we consider conservative treatment that may help them. But as the disease progresses and the arthritis worsens, the only definitive treatment at that point for most individuals is a knee replacement. So it depends on where you're at in the process, and we help determine that by x-rays, and we can see definitive evidence of osteoarthritis based on x-ray findings. When people are ready to have surgery, it's usually a combined decision. Some people feel they're not ready to have surgery or may not be a surgical candidate. So both parties need to come together and make an informed decision, and it's a shared process that it's time to have surgery. So when we get to a point that patients are ready to have surgery, we sit down and discuss with them the goals of the surgery, the risk of the surgery, what they can expect before surgery, during surgery, the acute rehab, and the follow-up that's required, and how long it will take to actually recover from the surgery itself.